Okay, everyone can hear me okay? Brilliant. Thank you. My name is Chris. I'm a lead physiotherapist over at the Enhanced Respiratory Service, which is on your doorstep at Rochdale Infirmary. So, yes, I'm going to talk about post-COVID syndrome, but I thought I would plug our service a little bit as well, to all of you here and at home as well. So, as part of the Enhanced Respiratory Service, we are here representing a whole of specialists, a whole team of nurses, physios, we have psychologists at the back, occupational therapists at the back, they're putting their hands up, so speak to them after if you need to. Hetal as well, another nurse here, taking a photo of me. The service is huge. For anyone who is familiar with the condition COPD or bronchiectasis, if you have a confirmed diagnosis of that, we have a team of nurses that see people at home 7 days a week. If anyone's got a chest infection, they will go and see them at home and make sure you get better, give any advice, treatment, antibiotics, anything that you need to keep you at home and get you better. We also have a pulmonary rehabilitation service. It's called Keep Active, Breathe Better. So it's an exercise class for people with any lung condition or lung disease, which is a big part of our service. And we also have the post-COVID syndrome service as well. So last year, we really focused on building the quality of our service. And as Steve introduced at the start, we have just been accredited to the Royal College of Physicians, and only 12 services in the whole of the country have achieved that so far. So we're a really high quality service, trying to do the best we can for the people that come and use our services. Last year as well, we also won a Customer Experience Award for the whole of Salford, Rochdale, Bury and Oldham. So again, it just shows the commitment that we have to put patients at the heart of everything we do. And last year, I presented quite a few times, not with the mic in my hand or being on YouTube, but I did present to GPs. There was over 50 GPs in one room, to practice managers, and to nurses who work in the GP practices to get our message out of what our service actually does. So now we've done all that, and now our focus is with you guys to get our message out to the general public. So being given the opportunity to do this by Sohail and Tariq is fantastic, and we honestly hope that this is the first of many opportunities we get to come out and speak to the communities across Haywood, Rochdale, Middleton, Castleton. We'll crack on with post-COVID syndrome. So with the GPs as well, we did ask, how do we engage with our communities more? In their opinion, what would be better? And it is coming out into services like into community halls like this, having translation, which I've put on the slides here to hopefully engage more with yourselves. And just, we want to use every opportunity we can. So post-COVID syndrome, if you think of acute COVID, which Ruth did talk quite a lot about with regards to an acute infection, that's within like the first 4 weeks of having COVID. It's acute COVID, it's made you generally unwell. And hopefully within that 4 weeks, things have got better, you've recovered, and you've gone back to normality. There is an ongoing symptomatic COVID, so that's kind of symptoms are lingering 4 to 12 weeks. And then we get into the category of post-COVID syndrome. So this is off the NICE guideline. It's the National Institute of Clinical Excellence, which develop a lot of guidelines that the NHS use, and this is their official definition. So it's signs and symptoms that develop during or after an infection consistent with COVID-19 that continue for 12 weeks or more. So the symptoms that you had initially when you first got COVID, they've not fully gone away. They're still lingering, they're still causing you problems, and that's when it comes into post-COVID syndrome. The public, social media, they kind of developed the term long COVID, which is much more wider known than post-COVID. In the healthcare professional side of things, we deem it as post-COVID, but the general public say long COVID, and it's kind of like the same thing. Thanks. So just another little bit of background about us. We've been a post-COVID service since March 2021. We've seen over 550 people come through, and the good thing about our service is that we see people face to face. There are services that are set up and they're just over the phone. We do see people face to face, and I'll come on to that in much more detail later on. We were using evidence-based practice at all times. When COVID first hit, there was no evidence. Everything was evolving, and there were many times when I first started and I was seeing people in front of me where I actually said, I don't know why you're feeling like this, because it was all new. But now, slowly, over more time of seeing patients, we're learning so much and how to treat things. Thank you. And with that, the three most common symptoms that we do see coming through in the clinics, and this is not just in Rochdale, this is kind of nationally, has been fatigue, breathlessness, and this brain fog. Brain fog meaning that you can forget people's names, you can forget why you walked into a room to get something and stuff like that, and it can really get people anxious, it can really get people down about, oh, what's happening, why am I changing like this? These are the three main symptoms that we see coming through on a regular basis. There's an app that has been created for COVID-19, and in that app we ask people to kind of log what their symptoms are, and this is for the central Manchester area, or Greater Manchester, sorry. These are the common symptoms that were being logged by people just purely off a questionnaire and what they were experiencing. So we've got fatigue, pain, issues with functional daily tasks, anxiety, problems with cognition, memory, breathlessness, cough, breathlessness at rest, feeling low mood. There's so many symptoms. It's not just where you go to a GP and you might be only allowed to talk about one thing. With us, there's lots of things. It's kind of impossible in the realms of post-COVID syndrome that we can just talk about one thing. It's very rare that I've met one person who's just got one thing going on. There seems to be a big cluster of these symptoms. So what we did as a team, recently we set up a little bit of a project where we tried to tackle these most common symptoms by looking at what skills we have as professionals, me being a physio, psychologist, occupational therapist, and how we can help people that come through to our service the best we can. Thanks. See you again. So we focused on these, and then again. So we can split them up into a physical aspect, and we can also look at the mental aspect, and there's a big crossover between the two. And it's really important that we look at that. And I think when we first started the post-COVID service, there was a lot of people that would come through and say, I think it's all in my head, or people are dismissing me, they're saying it's not real, these symptoms are something else. And so many people felt like when they came in front of us that they were a fraud sometimes almost. But these symptoms that the people are experiencing were really real, and it's how we address these. So there's a big correlation, this slide, thanks to Rachel. This just shows the correlation between physical and mental health, that there's a big crossover in this area here. How our mind is thinking can impact what our body is thinking as well, and what's happening there. So we can't dismiss the crossover between the two, and this is what we try and do in our service. So by physio, occupational therapy, and psychological medicine. So we're trying to do almost a three-pronged attack on treating the symptoms the best we can. Thank you. So physiotherapy, what do? I basically will look at your lung function. So people think of physios as knees and backs and stuff like that, but no, we do lungs, we do many different things, and one of them is specialising in lungs. So we can assess your breathing. A lot of people have cough, a lot of people have a change in their breathing pattern. We don't think about our breathing generally on a day-to-day basis, but it's the first thing we have when we enter the world, and it's the last thing we have when we leave the world as well. But our breathing pattern can actually change, and that can change by physical means, and it can also change by mental means as well. If we're anxious, you don't tend to breathe calmly, you breathe quite fast, and that has a massive impact on how we breathe on our body. So we work on that. We will work on exercise if we need. Everyone knows there was a big time when we were all isolating, stay home, stay safe. And a lot of people generally deconditioned in that time as well, not exercising, not going to the gym. Many services, many gyms were closed. So just working through that as well. And we can also arrange special tests. So yes, we are health professionals and allied health professionals, as their official term, but we have access to doctors like Ruth, specialists, consultants, you name it, we can get special tests done and explore further to try and get the best treatment for you to make you feel better. Moving on to occupational therapy, we've got Laura and Lauren at the back. I won't call you both up. But yeah, they're occupational therapists. They specialise in managing fatigue, they can give you advice on how you're managing your activities of daily living. They can look at if you need any specialist equipment to help you in any of your tasks. They can look at sleep. There's so much occupational therapists do. I can't sing their praises highly enough. So it's really, really good to have them on board on the team as well. And then psychological medicine. So yeah, so much again with regards to the psychology. So a team, they help you live alongside your COVID symptoms, offer group therapy, one-to-one therapy, focusing on your functioning and your overall quality of life. And again, like I've already kind of touched upon, the cross between the physical and the mental aspects of how you're managing your life at the moment. So yeah, I can't sing enough praises about the service, really. There is a really good website. So this, if you're really good on the web, it's called Your COVID Recovery. So if you're at home, screenshot or take a photo of it now. It is fully translatable into any language or lots of languages. Put the Urdu version up to show you. So it's just got self-tips, general advice, a lot of what Ruth was going through with you before on tips and stuff like that. It'll tell you what the common symptoms are and what you can do to self-manage. When it becomes more than that though, and things are worsening or not getting better, as Ruth touched upon before, then we do encourage you to contact your GP. Because GPs, like I said, we've been out to them, they know about our service. It's you guys that maybe don't know about our service, but hopefully spreading this message it will. Contact your GP will then initiate a referral to us, and we act very, very quickly. At the moment, we will see people within less than 4 weeks. So we will see you very quickly, assess you, you'll have an initial telephone triage to go through your symptoms, and then 95% of people will come through and see us face to face, and we'll go through to see how we can best help you and put you on a kind of a treatment pathway to hopefully get you fully recovered off from your symptoms. Next slide. And again, just more kind of examples of what the website is about. So yeah, so again, thank you so much for allowing us to come and talk to you today. As I said, there's so many strings to our service that I would love to come back if you let me and you're happy and the sound quality is okay for me, all this lot. If you're happy, because like I said, pulmonary rehabilitation, the exercise classes, so if you have or know anybody in your family or any friends who have COPD or any condition like that, then I'm happy to come back and tell you about pulmonary rehabilitation. And with regards to COPD, again, unique to our service, we are setting up a study which actually starts on the 1st of February, and we're hopefully designing an exercise class specifically for the South Asian population. So again, that could be looking at how we design a class. Would it be a same-sex class? Would it be in a mosque? Anything like that? But again, we're trying to really engage with the local community and provide and just try and reduce health inequalities that we see all the time. We want you to access our services, definitely. Okay, so if more information about that, I'll just plug Amy. If you put your hand up, Amy, So yeah, Amy in the room has got a little poster on the study that we're looking at starting. It's ourselves in Rochdale, and there's Leicester as well. So Leicester are a really big service in terms of respiratory in the whole of the country. And again, another great scalp for Rochdale is that we're being paired up with Leicester. So hopefully I've said enough about our service for you to know that it's a high quality service. And like I say, we're just on your doorstep, and spread the message basically. Thank you.